Welcome to this episode of Peds Talk. I'm Dr. Jameel Smith, lead integrative behavioral health psychologist and clinical assistant professor at Wayne State University School of Medicine and at Wayne Pediatrics. So September is Childhood Obesity Awareness Month, and to learn more about this common condition, I'm here with Dr. Kumba Njie, a board-certified pediatrician here at Wayne Pediatrics. Dr. Njie treats common illnesses, does routine testing, monitors for patterns that may require more evaluation, and recommends vaccines. Thank you so much for being here, Dr. Njie.
Thank you so much for having me, Dr. Smith. I'm excited to be here today.
Yes. So with this being Obesity Awareness Month, can you help us understand what is obesity? I mean, in a lot of situations, a child might carry a little bit more weight and a parent might think that's totally fine. So how can we help parents understand what obesity is?
Absolutely. So yeah, obesity occurs when a child's BMI is above the 95th percentile based on their age. So in simple terms, this means that your child is outside the average weight other children their same height and gender and age have. Children with obesity are also more likely to have many other illnesses, chronic illnesses like asthma. They could also have sleep apnea, type 2 diabetes, high blood pressure, high cholesterol, heart diseases, strokes, and even some certain types of cancers.
Oh, okay. So, you talk about a child being outside the average weight, and how can we prevent obesity? If a parent is sort of thinking that there's nothing really wrong, how can they be thinking about how to prevent their child's weight and BMI from being a problem?
Yeah, so obesity is a very complex issue and it has many factors that come into play. Things like, how much money your family makes, where you live, your own genetics and genetic makeup, they all play a role in your child's weight. But regardless of the risk that your child or you might have to develop obesity, you can do certain things to help lower that risk. Things like encouraging regular exercise, cutting back on salty, processed, and high-calorie foods, eating more fresh fruits and veggies, lean meats, grains, and legumes. Also understanding how much you're taking in and how much you're, burning out, which means in terms of calories. On a day, for example, that you're not very active, you don't need to eat as much because your body doesn't need as much energy to function. But on a day that you exercise, then you would tend to eat more calories to help, maintain your body's needs because of that exercise that you're doing for that particular day.
Okay. I know that it can be a sensitive topic to kind of talk with parents and even kids about their weight. How can we address weight loss in a positive way?
Right. So children are very likely to have a low self-esteem, and they might also experience bullying in school. And that can hurt their feelings. And they might feel as though they're being judged based on their weight. So a good advice would be not to focus so much on weight loss. Instead of focusing on the problem, focus on the solutions instead. Be positive about it and encourage your child to eat healthy and exercise rather than just focusing, oh, you need to this much pounds this week, or you need to lose this much pound this month.
Yeah, I like how you phrase that, focusing on the solutions instead, instead of using telling the child you need to lose weight. One example might be, how can we live a healthy lifestyle? How can we have a healthy diet in general?
Right.
How can we support patients and their parents in trying, when following these guidelines is kind of difficult, right? Because we're talking about habit change. We're talking about maybe something that the whole family has to tackle. How can we do this when it's difficult?
Right. So addressing obesity can be very challenging because, like I said, it's a very complex issue and it requires wholesome changes, like going from lifestyle modifications, in terms of the diet and exercise. But overall, having a very good lifestyle habit, building healthy habits at home for yourself and your child goes a very, very long way. Sometimes when I see my patients in clinic, I have had people say, well, I know he's not supposed to have soda and not supposed to have, chips, but then I get them for myself. But then at night or when I'm not around, they sneak and eat those things. So I usually tell them, well, if it's not in the home, then they won't have access to it. So what you can do is try to build a healthy lifestyle for yourself. Only get the things that are healthy for yourself, and that's what the kids is going to have access to. So if it's not there, they can't have it. So those are ways that you could actually help, having a good, healthy lifestyle for yourself and be a role model for your child. If they see you eating healthy, they're going to eat healthy as well. Also try to have appropriate portion sizes, because even if you're eating healthy and you're overeating, that is also not going to be helpful. So have appropriate portion sizes and, exercise regularly. When you go to the store, make sure you take your time to read the food labels, see what they're putting in those foods, what calories are there, and just to have a better idea of the kind of foods that you're bringing home.
Yeah. Yeah. That idea, if it's not in the home, then it's not going to be eaten.
Right.
That's a sort of a good sort of reminder of how we can support kids from not doing the sneaking, because that's, an easy thing to do and understandable. But if it's not in the home, then we can help them be successful. Well, thank you so much, Dr. Njie. We do have a dietitian here at Wayne Pediatrics, and our general pediatricians like Dr. Njie can help us and help parents be successful and help patients be successful in monitoring and preventing obesity. Childhood obesity is a common condition many children experience, and by practicing healthy lifestyles, we can minimize the risk of our kids developing it. Thank you so much, Dr. Njie, for teaching us about childhood obesity prevention. If your child struggles to maintain a healthy weight, please contact Wayne Pediatrics for guidance. For more information or to make an appointment with Wayne Pediatrics, your one-stop pediatric practice, visit waynepediatrics.org. Also follow us on Instagram, Facebook, and YouTube for new Peds Talks posting monthly. Remember, pediatricians are the best option for the medical needs of children. Take care.